Yeah, let's do a quick one.
Yeah. So I'm presenting to you Dr. Sorabh Bhargava. He's from Bikaner and a very high volume surgeon. So he will be showing us the third lens in the armamentarium of the Alcon people, the panoptics lens. For those people which you were just talking about, that they want distance, intermediate and near, then it is a panoptics. So over to Dr. Saurabh, sir. Dr. Saurabh, over to you.
Thank you. Thank you so much, the DOS faculty, the DOS organization, Dr. Sanjay Chaudhary, Alcon, for giving me this opportunity to operate live in DOS. Because of paucity of time, I've made the side ports and the pupil was slightly small. So we've injected a small amount of dye so as to, and the Orogel Plus, that is the viscoelastic, so as to improve the size of the pupil. Now I'll go ahead with the
Give us the microscope view, please.
Yeah.
Thank you.
2.2. That's it. So now I'm going ahead and making the incision. This gentleman, Mr. Virender Kumar, he's a 65-year-old gentleman having a grade 3 cataract. Astigmatism was just 0.2 diopters at 80 degrees. So a toric lens was not required. Now I am imprinting my rhexis onto the cornea with a Banerjee rhexis marker. RL. नहीं मेरे को दे दीजिए जल्दी नहीं. Now give me.
Are you centering the rhexis on the
yes, I have
Purkinje images or around the pupil?
See, this rhexis marker is a little bulky. Sometimes you don't get the image right in center and the patient moves. So then I center it on the center of the pupil. So it's both ways, it's accurate. No, it's okay. So I start off with the rhexis and I'm using micro utrata. This is basically a Haldipurkar micro utrata. And I'm aiming for a 5.25 mm rhexis.
Dr. Saurabh, did you use the Trapan blue?
Yeah, I've used the Trapan blue because of two reasons. His pupil was pretty small just when we draped him. So we used it in case he would have a small pupil. We would need the requirement of a dye, and now I've completed the rhexis. It's a 5.25 millimeter rhexis, round, central.
Yeah, very nice rhexis.
Thank you so much. Now we go ahead, we burp the incision to remove the excess of the viscoelastic, and we start the hydro procedure. And so here we get a good fluid wave. The shallowing, that is indicative of a good hydro procedure. We're getting the anterior portion of the lens forward, so that means the hydro procedure is complete. We reinstill viscoelastic, and now what I do is I dial the lens, the nucleus, both ways to one, ascertain that my hydro procedure is good, and two, remove the epithelial cells which are located at the back of the anterior capsular rim. So here you can see both clockwise and anti-clockwise. This will reduce the time I require for polishing of the anterior capsule. So the case I'm presenting before you is the latest technology with the Centurion, and here my parameters that I'd like to highlight to you are, I will not be using longitudinal phaco at any stage of the phacoemulsification. So this is purely torsional phacoemulsification, and the highlight, that is active fluidics. Light में देखिए, highlight is active fluidics. Flush कर लीजिए. The highlight is active fluidics, wherein there are three components to it. One is the, or flush कर लीजिए. One is the balance tip. Now this balance tip has a double hump design and it behaves like a straight tip. I was previously a user of the Kelman tip, but now I've totally shifted into the balance tip, and it also has an ABS system. Grade 2 है. So my preferred phaco technique is the direct chop. Just removing a few of the bubbles.
What is the IOP you're
Last
working
section.
on?
Third.
An IOP of 60.
And you have a vacuum which is at a panel setting of 500,
see,
right?
IP, just a moment. IP is off. Please switch on the IP. Yes, please switch it on. So there was a difference in the parameters that I was using and I'm getting here. The IP was off. Now IP is very, very important because the moment you achieve the occlusion threshold, there's a short burst and your pieces are. Why are the bubbles coming? So the balance tip and the active fluidics with the help of the active sentry, they maintain the chamber rock solid. At any stage of surgery, you do not feel the surge, whether it is a floppy iris, a myopic patient or a hypermetropic patient, a patient with compromised zonual support. In all these cases, you will get a rock solid. Flush kar dijiye, please. Biscuit allow. Flush kar, bas. That's it. Fine, fine. So the benefit of using pure ozil is that you can see the no longitudinal has been used and you get very reasonable CDEs. Normally my CDE is about 3 to 4. आइए I have always preferred the bimanual irrigation aspiration and I am proud to be using Dr. Chaudhary's bimanual system. Dr. Chaudhary has devised this bimanual system which has been manufactured by Epsilon people. Very efficient. IOP बढ़ा दो.
So what is different about this system?
What is different about the system? Okay. They are very compatible with your minimum size of the side port. So 1.1 mm side port, they are very compatible. Number two, their inner diameter is very good. The safety is not compromised, yet the speed of irrigation aspiration is very fast.
Okay.
So I've also used the Grishebar ones and the other ones, but I found these the best. And I've been using them for the past, I think, 5 to 7 years at least. So it's a well-centered rhexis, and we finished off the irrigation aspiration. Now just doing a small amount of cortical polishing, capsular polishing. I think that's sufficient. I just flush out the few of the cortical fibers which are attached to the posterior capsule. I have this habit of using a hydrodyelination cannula and just flushing it off from the posterior capsule. it just, I think, in my hands, it reduces the incidence of PCO, and all these little fibers, you can really just flush them off without taking any risk. Okay, so that's it. So the surgery is done. Now the choice of the implantation. This person has an implantation of has a multifocal implant in the right eye, and was desirous of the same implant. So as a study by Sharon Wong, who says 99% of my patients who use panoptics opt for the same lens in the other eye. So is the case with Mr. Virender, and he has opted for a panoptics lens. Now, panoptics lens has been a game changer since the last 2 years. Basically, I consider panoptics not a trifocal. I consider it to be a quadrifocal, which has been optically modified to give us a complete flowing range of vision from near, intermediate to distance. So for those patients who want, for those patients who want class A vision for near, A vision for intermediate, and A class vision for distance, this is the lens of choice. And I'm sure you agree that there are a lot of people 60 plus who are not so active now. They are not nighttime drivers. They have very homely activities, playing with their grandchildren, playing some games, gardening, watching television, watching the mobile, and they drive, but they don't drive so much at night. So I'm sure you agree, most of these people don't drive at night as it is. So if you have such a kind of a patient, I think the panoptics is the lens of choice. Here again, I deliver the light में देखिए, light में please फिर वो ocular डाल लीजिए. I deliver the lens straight into the bag. Dialing is just for the 0-180 positioning of the lens. So
very nice, Dr. Sorabh. I observed that you didn't inject the viscoelastic inside the cartridge. Are you comfortable?
I didn't do it. My assistant did it.
Okay.
It was there, but I just felt that is a difference in the injector that we use at our place and other places. That is a slight, that is a slight occupational hazard to do live surgery.
Beautifully done, I think. Very nice.
Nicely done.
Nicely in the bag.
As you can see, this is the panoptics. It has 15 rings. It has a central 4.5 millimeter diffractive zone. This is very good because it is not so much dependent on pupil. It's not, in fact, not dependent on pupil size, and it's very forgiving if there is slight amount of decentration. As you can see, the rhexis is covering the entire 0.5 millimeter of the optic edge. So moreover, because of the 88% light transmission to the retina, and of which 50% is dedicated to distance and 25 are dedicated to intermediate and near, this lens is a fantastic all-rounder.
Very nicely done surgeries, all of them. We got a range of all the different lenses and their attributes. Very nice technologies in the machine as well as the lenses that Alcon is giving us. Great to have all the panelists, and congratulations surgeons, and Dr. Chaudhary, thank you for this great session. I think we'll have to vacate for the next session.
Any question from audience?
Thank you, Saurabh. That was excellent surgery. Very nicely centered with very nice overlap of the anterior capsular rim.
Thank you so much, sir. Thank you.
With